أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen, this year in 2006, we've been receiving more questions by email and by fax and by snail mail than before. We're going to hope and pray that this means that our program is becoming more popular in many countries, because the vast majority of these questions are coming from Europe, from England, from France, from Africa, and other places around the Gulf, but especially from UK. We seem to have a pretty large and increasingly developing audience and viewers from the United Kingdom, and we welcome you. So I've been receiving quite a bit of emails recently, and I thought it would be a good time to stop and take a few weeks and try to answer as many of these as we can. We can't answer all of them, but I tried to, to answer the ones that are the more common questions, and some of the people where it's a bit sensitive, I'll just reply to them by email, and I will not broadcast it on the air because some of the questions are a bit personal. But we are receiving, alhamdulillah, a lot more questions now than before. So today will be question and answer Q&A 2006 Part 6. And this is an email from the United Kingdom. Dear Dr. Bilal, my family and I would like to send you a note to tell you that we are very pleased with your program, which passes on Sharjah here in the UK time on Friday nights. It enlightens us about the human body and tells us many things that we found beneficial. Many things that we found beneficial. One thing especially that comes to mind was when you spoke about olive oil and having olive oil and za'atar, zait and za'atar, in the morning for breakfast. Unfortunately, I have a hiatus hernia, which doctors say I have had probably all my life, but through overeating have made the problem greater. I do unfortunately eat quite too much at sittings, as do many of us, myself included. However, I found that by skipping the large breakfast, this is a very important point of this email. However, I found that by skipping the large breakfast I used to have, and instead having olive oil and za'atar with pita bread, that's the round bread, over about 4 months, has helped me enormously. This has helped me enormously. The bloatedness has left me, and I have also managed to get rid of the anxiety that was associated with the stomach upsets and esophageal reflux. I now tell all my friends about olive oil and encourage them to take it regularly. I found my body to be more relaxed and have much less tension and stress due to the use of olive oil. Barakallahu fikum, subhanallah, and may Allah, give you helpful advice, inshallah. P.S., this is a footnote. He says, I would be grateful if you could possibly pass my salams to Brother Uthman Bari, as we also take great pleasure in watching his show. We learn so much and we increase the strength of our faith. We feel every time we see the program. My children laugh sometimes when they say, it's as if Mr. Uthman and his guest are sitting in our living room with us. It's as if Mr. Uthman and his guest are sitting in our living room with us. It's such a relaxed and friendly program. Yours sincerely, your brother in Islam. Well, there's a lot of information in this email, but the first thing I want to talk about is Brother Uthman Bari, because actually, due to him, this program pretty much evolved. His program is called Discover Islam. Has been aired in like 7 to 8 years now maybe a little bit longer on Sharjah TV, and myself and so many other people were regular guests on that program, and by the public seeing us and by the TV getting good response from our visits on his program, eventually other programs evolved out of his program. And Medicine in Islam is, to me, an offshoot of Discovery Islam, because my first beginnings with Sharjah Television on a regular basis was with Discovery Islam as a guest, along with so many other people. And it just seems kind of a coincidence, if there's such a thing, that my program, Medicine Islam, airs on Friday nights just after the Arabic Quran and then the English Quran. And shortly and immediately after my program comes Discovery Uthman with his guest on a regular basis. So our programs are aired back to back on Friday night. So we're in a way, I would say, joined at the hip a bit. But I have a lot of gratitude for Brother Uthman, and since the brother mentioned in this email that even his children say it's as if Mr. Uthman and his guests are sitting with us in his living room. This is an informal, relaxed, a bit of cheerful atmosphere that program emits. They do not cover medical things nowadays because I'm having this program, but in the early days we should talk about medical topics on that program. So all the best to Brother Uthman, and for those of you who are following this program, we encourage you to follow all of the English programs on Sharjah Television, not just from Brother Uthman, but from other brothers such as Tahir Khalid and Abu Dawood and others. So we want you to watch as many programs as you can, because all the brothers are working very hard to try to bring you good stuff, okay? The things that you can use in your practical life. So this email is mainly about the benefits of olive oil, and we've talked about this off and on, and the questions keep coming off and on about olive oil. And before we get into the benefits of it, I just want to say that, this is my own personal experience. Way back in the late 80s, when I was living in America, I was sitting with some Jordanian brothers, and for every morning in breakfast, they would have zayt and za'atar. And this is the first time I was ever introduced to it. They would also have a little butter and honey. And at that time, I was not diabetic. So I was focusing more on the butter and the honey, with bread, because it was sweet. But they were focusing more on the zayt and za'atar. And I used to say, eat more of the zayt and za'atar. It's better for you. Eat less of the butter, But that's when I was first introduced to it. Then when I moved here to the Middle East in 1991, when we would be with other Arabs, wherever we were, and it was breakfast time, I found this to be a very commonly served breakfast for the Arab people. And I was told that in Philistine and in that area, many of the people are in the tradition of just drinking olive oil, straight up in the morning on an empty stomach. The first thing they do before they eat or drink anything else is they drink olive oil pure. And this is supposed to be a sunnah. I was told by many people that this is a sunnah. So this olive oil has tremendous prospects and tremendous benefits, but it's on a dose-related basis. The more you take, the more benefits you get. The less you take, the less benefits you get. And it's not just the olive oil, but it's also the olives. In my home, what we try to do in my home, in the mornings, I have zayt and za'atar. I had it today before I recorded this program. And in the evening, when I take my evening meal, my habit is to have a salad which contains olive oils. Now, olives themselves, not olive oil, but olives. Now, I am particularly liking the black olives, but some people like the green olives. It doesn't matter. They both are very potent. So olives and the olive oil. So I get a bit of olive oil in the morning, and I take olives in the evening nearly every day. And if I miss one, I will definitely get the other. So some type of form of olive oil is in my system every day. I found it to be tremendously beneficial, and we're going to give you some examples in this program that's going to really be mind-blowing. I mean, some of the things that have happened to me and my family and friends because we started using it several years ago. So now we want to spend the rest of this program talking about some benefits of olive oil. Some benefits of olive oil. As this brother so clearly illustrated in his email, the benefits that he received and how he's encouraging other people in the UK to do the same thing, we want to encourage you to do the same thing, because this is something that's available all around the world. It's not like camel's milk that's hard to get. It's not like black seed that has to be ground down. You just go to any supermarket and olive oil is there. Okay? So let's now spend the rest of our program talking about some benefits of olive oil. The first thing, which is one of the most common and widespread benefits, is that it aids in digestion, and which means it helps indigestion. People that have trouble digesting their food for whatever reason, olive oil is safe. There's virtually no side effects to it. It's not a chemical drug. It's a naturally occurring substance, and it aids the digestion from the time you take it, but the lower it gets, the better it gets. It aids the colon, I say tremendously, the small intestine some, the stomach some, but the place where it really works well is the colon. And this is the place where you get constipation, okay? Now also, the brother mentioned he had a hiatal hernia. Now hiatal hernia is kind of like it's when your stomach slides up into part of your esophagus when you lay down, especially after you had a meal. Now this can be sometimes dangerous because just like in hernias with small children in the inguinal area between the legs, the hiatal hernia can catch bowel sometimes. Sometimes your intestines can be caught, and we call it being incarcerated, just like being put in jail, being caught and incarcerated in the hernia. And if that is not released, that could be a need or a cause for immediate emergency surgery. It can cause acute abdomen, which is an acute surgical condition. So hernias, may be, should we say benign and cause no problems, or if they're in certain places or if they're certain sizes, they can actually capture and catch bowel in them and squeeze and twist that bowel, and if you don't correct it, you can die, because if it ruptures, you can die. So with the use of olive oil, his hiatal hernia improved. And I know other people personally that also have hernias in their upper abdomen that have received relief from using olive oil regularly. The hernia is still there, but it doesn't cause as much discomfort and problems as before, especially when you lay down, because when your head is up, and this is your head, and you're in this position, it's not a problem. But when you try to lay flat and lay down, then the hernia slides from your abdomen into your food pipe, and it causes a lot of esophageal reflux and acid and burning, and is quite discomforting. It can even come all the way up and even go into your lungs and give you pneumonia and bronchitis. These are the extreme cases. Number two, a second very common benefit, and we mentioned this briefly already, was that it relieves constipation. Now, constipation usually occurs in the large intestines, or what we call the colon. Okay, and olive oil and olives, for some reason, have a very, very strong effect on very many aspects of the colon. The first and most common one is that it relieves constipation. Okay, and constipation can be a precursor for other disease. If you have, chronic constipation, you're more prone to having hemorrhoids because you're straining. If you have chronic constipation, you're more prone to develop polyps in your colon because the feces and the toxins are residing in your colon for a longer period of time. Instead of passing through, they're hanging out in your colon. You're more prone to have diverticuli, which are also abnormal, and they can cause diverticulitis, which is an acute inflammatory process and can be very painful. And the worst scenario, which is also connected to chronic constipation, is that because these toxins, which should be coming out of your stools, out in your stools, are trapped in your colon over periods of time, over a period of months to years, these toxins and the accumulation of these toxins in your colon can cause colon cancer, carcinoma of the colon, and God knows we don't want that. Okay, so olive oil is really great stuff. Number three, olive oil itself also reduces the swelling of piles or hemorrhoids, which is in the sigmoid rectal area. Sometimes when you have this bad and you're straining, you feel like something's coming out of your rectum. This can be hemorrhoids or piles, or it could be the rectum itself protruding. I just learned this recently from Dr. Samur, who is one of the very renowned surgeons here in Sharjah. We had conversations about this. But olives and olive oil can reduce the swelling and inflammation of hemorrhoids, okay? It can also be applied directly to the hemorrhoid, okay? Topically, directly to the hemorrhoid, it can be applied, and it helps the swelling to go down. Now, the next thing is a very, very interesting finding. You know, we get information from Quran, we get information from Hadith about various types of natural medicine, and we should accept it, and we should believe it. And what has happened in the last 10, 15 years is that Western medicine has started to take an interest in Islamic medicine, and they want to do research to see how these things work. They don't doubt that they do, really. They just want to see how it works, so maybe they can come up with something similar that is less expensive or more available that can help you. And what Harvard Medical School found out several years back, and we've talked about this before, but for some of you who have missed that program, Harvard Medical School has come to the conclusion that the regular use of olive oil and olives, but especially the olive oil, actually prevents colon cancer. It prevents colon cancer. Bang. This is one of the leading causes of death from cancer in the whole wide world. Amongst African American blacks, which I am one, is the most common cause of cancer, okay, and death from cancer. I have so many friends and colleagues and relatives that have passed away from this disease. One of my very close cousins just passed away a few months back from this disease. So this is something that is close to my heart because I know so many people that have it. And we want to try to find out a way that we can advise people to try to prevent it who are high risk. And the highest risk group are black American males. So, and there are other groups also, but especially those that eat a lot of meat, they have this problem. We're almost out of time, but we're going to try to finish this. The last point about the main benefits of olive oil, also very important, and that is that it lowers cholesterol anywhere from 30 to 40 and as much as 50%. It can lower your cholesterol and actually cut your cholesterol in half if you use enough of it. Here again, it's dose related. The more you use, the better the effect. The more you use, the lower your cholesterol is. And I want to tell you a short true story before we run out. I was diagnosed in 1993 of having high cholesterol and high triglycerides. And I was on medications. The first one was Zocor, and it lowered the cholesterol some. It didn't touch the triglycerides. I was trying diet with the medicine. They switched me from Zocor to a medicine called Lopid. Twice a day, big tablets, 600 milligrams. Again, it helped out some on the cholesterol, and the triglycerides went down some, but not completely. And then what happened is the Lopid went out of stock. And at that time, I read that olive oil reduces cholesterol. So I started taking zayt and za'atar and using olives in my salad. And I will bear witness that it's been nearly 4 years now. I have been on no medication for high cholesterol and triglycerides. And my LDL, which are the dangerous cholesterol group, the low-density lipid form of cholesterol, has been normal and even low normal. I had one a few weeks back. It was even 77, with the normal being up to 180. So on no medications, off of all medications, with the regular use of olive oil, my own cholesterol has been normal for 4 years now. Which greatly decreases your risk of heart disease, strokes, and other forms of vascular disease. And with that, my dear viewers, we're out of time. We always encourage your questions and your comments. You can write me at Medicine in Islam, P.O. Box 111, Sharjah Television, Sharjah, UAE. Or you may send me a fax at 9716-5311-969, 9716-5311-969. Or as most people choose to do, you may send me an email at medman@emirates.net.ae. That's medman, MEDMAN @EIM.AE. And as our custom on Medicine in Islam, we like to include all of our programs with a short dua, a short prayer of the Prophet Muhammad sallallahu alaihi wasallam, such that if any mistakes or errors have been made on this program, and most importantly, if any sins have been committed on this program, that Allah subhanahu wa ta'ala in His infinite mercy and grace will forgive us. Subhanallah wa bihamdihi, subhanakallah wa bihamdika, wa nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk, nastaghfiruka wa natubu ilayk, nastaghfiruka wa natubu ilayk. Jazakumullahu khairan. May Allah reward you with the very best Islam.